Hi there, welcome back to class. Today we are going to cover the 5 basic principles for Matthew Stott Pilates. This is a great video if you are a teacher looking to review the principles or prepare for your exam. It's also a great video if you're a student of Pilates, beginner all the way up to advanced, that wants to deepen their understanding of the 5 principles so that you can enhance your practice, whether it's on the mat, the reformer, or any other piece of STOTT equipment. To get started, go ahead and come all the way down. If you know that you like a prop under your head or you like a prop under your hips, feel free to grab a prop. We'll come lying onto our back, bending the knees, planting the soles of your feet on the mat. For this first bit, the first principle is breathing, and it's nice for yourself or for a student to just take a couple deep breaths and notice where your natural breath pattern lies. So let's try that. Take a couple deep breaths, just down into your body. And allow yourself to notice where the breath lands. Maybe you place a hand on the body where the breath is landing. It could be upper chest, rib cage, lower belly. And so let's note here, when we have upper chest breathing, it can create tension, additional tension in neck and shoulders. So we want to draw the breath down, deeper into the lungs, deeper into the body. First principle from here, after noticing the natural breath pattern, is taking it into our 3-dimensional breath pattern, which is in the ribs. So to orient your awareness to your ribs, place your hands on your rib cage so that the fingers kind of connect, or they get close to connecting, and the heels of the hands relax down towards the floor. You can take it there, or you can take the hands and wrap them around if that feels better on your shoulders, so that you feel your fingertips to the side of your rib cage. Either way, wrapped around or resting on the front, let's start into our Pilates breath. So we inhale through the nose, letting the breath come into the side and back and front of your rib cage. And then exhale through a straw, pressing the breath out. Good. Again, inhale through the nose. This will warm, humidify, filter the breath, fill the lungs, back, front, side. Exhale through that pursed lip, like you're breathing out through a straw. Good. Take 2 more. As you inhale, think of like an accordion or an umbrella opening underneath of the rib cage, like a balloon that you're filling up. And then as you exhale through a straw, you will feel that rib cage deflate, balloon deflates, and the upper abdominals engage. That's what we want. Take another one final deep breath, 3-dimensional inhale through the nose, warming, humidifying the breath, filtering the breath, and then exhale, press out through the mouth, through a straw, that pursed lip, feeling your upper abdominals engage, and you'll notice your rib cage draws down and in. Second part to the breath. So we have the rib cage breathing, which is our thoracic diaphragm, and then we have our pelvic floor and transverse breath. So I like to think of this like a capital T. If you think of your vertical T as coming from your pubic bone to your belly button, that vertical line of the capital T, and then your hip bones here in the front, you can palpate those, are the horizontal line of that capital T. So the first breath we'll do is the vertical line. That's the pelvic floor diaphragm. It's this little lift, like we're hugging in a tampon, or we're using a Kegel, or just a little lift if you have to wee. So you can rest your hands if you want in this thumbs together, index fingers together, triangle on your lower pelvis there. With the fingertips on your pubic bone, take a breath in down into your pubic bone. See if you can soften the pubic bone, the pelvic floor, the pelvic diaphragm as you inhale. And then as you exhale, just think like a little zipper, pubic bone to belly button, you're zipping up, pressing the breath out through that straw. Good. Take 2 more like that. Inhale down into your pubic bone. Like a little pair of skinny jeans. As you exhale through the straw, think pubic bone to belly button. There's this little lift deep inside the pelvis. Wonderful. Last one. Deep breath in. The contraction is about 25%. So as you exhale, just small little lift, belly button, pubic bone to belly button. Press the breath out. Really gentle lift there in the front of the pelvis. Good. So now if we had a pair of jeans on, we zipped them up. Now we're going to belt them across. So imagine you've got a belt across the front of the pelvis here. That belt is the same horizontal line of your capital T, and it's tightening one belt notch. So if you take your peace sign fingers and rest them on those bones, you'll feel the bones there. And then just bring your fingers inside of those bones for a moment and kind of rest. You can press into that tissue. It's kind of soft to start. But what we want to do is inhale down into the pubic bone. So try this with me. Take a deep breath in. And then now as you exhale, you'll zip up butt, belt, and belt in. So exhale through the straw, zip up, and then press the breath out, but feel like a belt tightening one notch. Those 2 hip bones kind of draw together. And you can probably feel a little muscle pop up there under your fingers. Let's try 2 more. Capital T breath, deep pelvic breath, inhale. 25% exhale through that pursed lip. Just zip up, belt in, hugging across the front of the pelvis. Like a little trampoline underneath of the pelvis there. 1 more here, deep underneath of the finger. Deep breath in. Good. Zip up, hug in. Pressing the breath out. Good. Take the triangle back onto the front of your pelvis there. So we're going to work with this breath now into our next principle, which is pelvic position or pelvic placement. So when the pelvis, all we're doing here is learning how to move the pelvis because it helps 2 things, a lot of things. It helps lengthen and mobilize our lower spine, and it helps to dissociate the pelvis from the hip, which makes for a much happier hip joint and functioning hip. So take it for what it is. It's a really gentle movement, but it will start to train the brain to discern how to use your core and mobilize your lower back. So taking the 3 points as your index finger or your pubic bone and the 2 hip points or the heels of your hands. So when that triangle is level, imagine you've got a little cup of water, a teacup, resting on that triangle. When those 3 points are level, the pelvis is neutral. Take a deep breath into neutral. Stay in neutral, zip up, hug in, exhale. Good. Now we will come to imprint. We're going to inhale where we were. But as you exhale, just tipping the little teacup, little bit of water tips towards the body. And you'll feel the waistband of your pants or your lower back kind of kiss the mat, just a little connection. Inhale, neutral. Level your pelvis. Exhale through that straw, zip up, hug in. Bring your lower back towards the mat. Imprint. Good. Inhale, release. This is a neutral pelvis. Exhale, imprint. Pubic bone to belly button, hip point to hip point, capital T, imprint. Good. Last one. Inhale, release or neutral. Exhale, imprint the pelvis. Pause it in your imprint. Think of like some little marshmallows under your lower back. We're giving those marshmallows a hug or a kiss, but we're not smashing them. So try smashing them. Smash the marshmallows. You'll feel your abdominals kind of pop out. That's too much contraction, you probably feel your glutes, your hamstrings, whether you're aware of it or not. So find just that little kiss of the pelvis, and let's practice imprint here. So keeping your pelvis in imprint, let's bring our hands by our sides. Take a deep breath in. As you exhale, maintain imprint, but zip up, belt in, and then use your core to float your right leg to table. Pelvis stays really still. Take a deep breath in. Challenging, more challenging than it looks. Exhale, zip up, hug in, using your core, float your left leg to tabletop. Stay here, deep breath in. Exhale, zip up, belt in, use your core to float your knee away, set your right foot down. Inhale. Exhale, zip up, belt in, use your core to float your left leg down. One more of each. Inhale, prepare. Exhale through the pursed lip, zip up, hug in, float the right knee up. Inhale here. Exhale, zip up, belt in, use the core and abdominals to float the left leg up. Inhale here. Last one, zip up, hug in, capital T, float the right leg away. Imprint stays at the pelvis. Inhale here. Zip up, hug in, maintaining imprint, float that left foot down. Good. So the pelvis will rock. We have neutral, you can overarch, that's a movement, but for the 5 principles, we have release, which is neutral, and imprint, which is that little marshmallow under the lower back. Next, let's take it to rib cage placement. So a nice way to think of it is like earlier you had your hands on your ribs. You could kind of feel how your ribs expand like an umbrella or an accordion, and then they corset down and in when they engage. So the rib cage will move, but we want to learn how to optimize its movement. So reach your fingers to the ceiling and just kind of feel the back of your rib cage. You can feel the back of your rib cage connected to the floor. And then slowly you'll start to reach your arms back behind you. And I want you to go all the way back and rest them on the floor or towards the floor. And notice how this is the improper position, but notice how your rib cage kind of flares out and you've got this arch, maybe even an uncomfortable arch in the upper middle back. Can you feel that? Rib cage is flared. So we lose the connection to our upper abdominals when we have the rib cage flaring. So what I want you to do is just float your arms a little bit off the floor, about nose height or ear height. For most of us, it's about the nose. And see if you can feel that rib then corset together. Try it again, relax, the hands back, notice that flare, draw the rib cage down and in, floating the hands to the just in front of the gaze, and you can feel that connection. So let's play with it. We'll inhale, reach the fingers to the ceiling. Exhale, you can still zip up, belt in, engage the upper abdominals as well this time as you reach your hands back to where you can keep that corset. So pause it. You should probably feel that abdominal. Take a deep breath in, fingers up. Exhale through the straw, corset the ribs, reach the arms back as far as they'll go with that corset. Last one, inhale here. Exhale, corset the ribs. Good, inhale here. You'll see a lot more in Pilates principles now. There's a scissor, so you can practice it here where you inhale, exhale, corset the ribs, reach one arm back and one arm forward. Inhale, ceiling. Exhale, other side, scissor. Inhale, knit the ribs together, exhale. Long through the fingers, inhale, knit the ribs together, exhale. Good, inhale all the way back and then release it down. You could practice arm circles, you could practice that shoulder coming back towards the ears. You could practice the scissors. Okay, so we've done breathing. We did rib cage breathing. We did pelvic floor, that capital T where you draw up and you belt in. That's pelvic floor and transverse abdominals. We did pelvic placement, so rocking the pelvis from neutral or release to imprint. We did rib cage placement, the flare to drawing in. Next, we'll take it to shoulder blades. So Staying on the back, fingers to the ceiling. Let your shoulders rest towards the floor. Collarbones are nice and wide. Now imagine you've got a string connected to your pinky and you're going to inhale. The string will lift your fingers up to the ceiling without shrugging your shoulders. Feel that connection of the fingers reaching in the upper abdominals. You could even feel the shoulder blades kind of wrapping around, and then slowly release, exhale. Good, inhale, reach. This is protraction, and then exhale, release. This is neutral. One more like that, inhale, reach. Exhale, release. Good, go ahead and grab a knee, come all the way up. We're gonna take the same thing, but just orient it here, seated, with the arms out in front. So before we did protraction, the shoulder blades kind of wrapped around the rib cage. You felt that broadening of your mid back. Now we're going to retract. So if these are your shoulder blades, they're wrapping around the ribs and they're drawing towards one another for retraction. So find neutral, broad across your collarbones. This time, inhale, draw your shoulders back. We don't have to over grip, but draw your shoulders back. And then exhale, return to neutral. Good, again, inhale. Exhale. One more here. So as we draw back, pause it there. Your spine will stay upright. We're not arching for right now. We're just mobilizing the shoulders and then reach it forward. Try a new version that we're seeing with movement in general, but definitely with Pilates. We've got this long vertical spine and we want to mobilize our shoulders where one reaches forward and one draws back. So think protract and retract and then switch. Steady your gaze, switch. Rib cage can rotate, switch. Good, switch. And it's just really nice. Inhale, reach. Exhale, row. Inhale. And exhale. Release it down. Good, so you can feel the rib cage rotating there. For the principles though, we just need to notice, can we protract? Can we retract? Can we feel the difference between the two? Another one here is the shoulders also elevate and depress. So think about collarbones are nice and broad. You'll keep the collarbones broad. So as we shrug, we're not collapsing in the front and we're not drawing so far back. Just keep this broadness across your collarbones. Take an inhale, start to drift your shoulders up. They don't have to over grip, but you feel them lift. And then exhale, take them all the way down. Two more like that. Inhale and exhale. Again, inhale and exhale. Good. So a lot of times you'll see when we flex forward, the ribs will knit together and the shoulders will kind of protract. This is a nice connection. We want that connection. Inhale, a lot of times as we come into what's known as extension, the spine extends, the ribs will flare some and the shoulders will retract some. So just know it's natural for the rib cage and the shoulder blades to move together. We don't have to feel like they're fixed and locked in either position. Just let that natural movement happen and your spine and shoulders will feel happier. Good. Let's come down to our back for our final principle, the head nod. Roll down one vertebrae at a time and just let the chin and the forehead or the space between your eyebrows, that place, those 2 points, when they're level, that's neutral. So if you were to look into if you were to look to the ceiling and imagine that the ceiling was a red light, traffic light on the red, the neutral position is straight up. And then exhale, we're just going to nod the chin as if we're looking towards the yellow light. So it's the tiniest little nod. Inhale, neutral, chin and brow are level. Exhale through the straw, look towards the yellow light. Good, take a couple more like that. Inhale, neutral. Exhale, a little lower of the chin. Good, one more, inhale. Exhale, lower. Good, neutral. So you'll see a lot of head nod when we're doing any kind of flexion of the spine. So let's try that here. We're going to inhale, this time lower the chin. Exhale, hover the hands, start to peel the head and shoulders off, reach forward. So we're not over tucking, we're not jutting the chin out, it's just red to yellow. Inhale here, exhale, roll back down. Let's do one more like that. Inhale, little lower, red light to yellow light. Exhale, hover the hands, flexing it forward. You'll feel your ribs connect. Take an inhale. Exhale, roll back down. Good. Go ahead and lengthen the legs. Let's come over onto our stomach and see the same principle, what reverse head nod. So if head nod is lowering the chin as we come into flexion more often than not, and then a little doggy whisker. And then as we come into extension, it's called a reverse head nod. So take your hands about, if you've got a mat, it's about parallel to the edges of your mat, and just envision this little marble resting under your nose. So this is neutral. You've got this tiny little marble resting just under your nose. You feel the length in the back of your neck. Legs are active. And you're just going to inhale, start to nudge the marble forward. So it's like the tiniest little reverse head nod. It would be like going from yellow to red, right? If yellow was straight down. So that might throw off the analogy some, but think inhale here. Exhale, just nudge the marble forward. One more like that. Inhale, neutral. Just ever so slightly nudge that marble. Good. Find neutral again. Now we're going to inhale, nudge the marble. Exhale, slowly lift up to like a breaststroke prep. So this is just extending through the spine without, try it with me, jutting the chin forward or tucking the chin under. It's just a natural extension of your spine, and then slowly lower. Find that marble. Good. Inhale, nudge your marble. Exhale, lengthen and extend. Inhale, pause here. Stay. Exhale, slowly lower down and just kind of reverse, come back to that head nod, finding the marble. One more. Inhale, nudge the marble. Exhale, use that to extend up and out. Inhale here. Exhale, lengthen as you come down, eventually lowering the chin to neutral. Good. Take your hands under your shoulders, pressing yourself back. Come to a shell stretch. Legs are parallel. We're actively connecting rib to hip. You can feel your abdominals there, and it should feel like a nice stretch in your lower back. Hi, amazing woman. Thank you so much for joining class today. My name is Mary Sarah, founder of Mary Sarah Coaching and the Soma School by MSC. If you like today's class, the full-length video is housed on our world-class app, the Soma School by MSC. We have teachers, healers, experts from around the world sharing their passion for women's health and physiology. We've got classes, courses, workshops, all good things to support your training, fueling, and optimizing who you are so you can train with your body and not against it. Thank you again, and I will see you for the next workout.